If you're over 60 and still masturbating, first of all, let me say this clearly. You're not alone, and there's nothing to be ashamed of. But what if I told you that the way you do it now— Hi, and welcome to Humans Health 360, your complete guide to better living and smarter health choices. I'm your healthcare consultant, could be silently affecting your penis health, your sensitivity, your strength, even your confidence. I'm your healthcare consultant, and in this video, we're going to talk openly and honestly about what happens to your body as you age, especially when it comes to sexual habits most men don't like to talk about. As we grow older, especially past the age of 55 or 60, our bodies go through many natural changes, and sexual health is no exception. This doesn't mean something is wrong with you. It simply means that your body is adjusting with time, just like your eyesight, joints, or energy levels might change. Understanding what's happening can help you take care of your health better, especially when it comes to something as personal as masturbation and penis health. One of the first things that changes with age is blood flow. Erections depend heavily on strong, steady blood flow to the penis. But as we age, our blood vessels can become stiffer or narrower due to conditions like high blood pressure, diabetes, or cholesterol buildup. This can make it harder to get or maintain an erection, even during masturbation. It doesn't mean you're not aroused or that something is wrong with your desire. It's your body asking for more support and care. Another key change involves nerve sensitivity. Over time, the nerves in the penis may not respond as quickly or strongly as they used to. You might notice it takes longer to feel pleasure, or orgasms aren't as intense. This is completely normal with age, but it's something to be aware of, especially if you're using strong pressure, squeezing too tightly, or relying on the same habits that worked for you when you were younger. Over time, these habits can actually reduce sensitivity further. Then there's testosterone, the main male hormone that supports sex drive, energy, muscle mass, and more. After age 30, testosterone naturally begins to drop each year. By the time you reach your 60s, you may have much lower levels than you did in your youth. This can affect your interest in sex, your ability to get aroused, and how your body reacts during masturbation. It can also impact your mood and energy, making you feel tired or less motivated overall. Tissue flexibility also changes with age. The skin and tissue around the penis may become less elastic, and the muscle tone in your pelvic floor, the group of muscles that support your sexual organs, can weaken. This might affect the firmness of your erections or cause issues like urine leakage after orgasm. Again, these are common changes that happen with age, and they're nothing to be embarrassed about. But they do mean that certain habits, including how often and how intensely you masturbate, may need to be adjusted to protect your long-term health. Lastly, emotional and psychological factors also play a role. Stress, loneliness, past experiences, or relationship changes can all affect your sexual health. For many older adults, masturbation can be a way to stay connected with themselves, reduce stress, and feel good. But if it becomes too frequent or feels like a hidden habit, it might start affecting your confidence or emotional well-being. In short, aging affects many parts of male sexual health, physically, hormonally, and emotionally. But the good news is, these changes are normal and manageable. With the right understanding and gentle adjustments, you can continue enjoying a healthy sexual life without harm to your body. And that's exactly what we'll explore more in the next section. As we get older, one of the most important things to protect is healthy blood flow, especially to sensitive areas like the penis. Good circulation is essential for maintaining strong erections, proper sensitivity, and overall sexual health. But when masturbation becomes too frequent or too intense, especially in later years, it can start to affect that blood flow, and not in a good way. Let's break this down in a simple way. During an erection, the blood vessels in the penis fill with blood, causing it to become firm. But with age, those blood vessels can become narrower, harder, or less flexible, a condition known as vascular aging. If you add frequent, rough, or high-pressure masturbation to the mix, you could be putting even more strain on those delicate vessels. Over time, this may lead to a decrease in how well blood can enter the penis, leading to weaker erections or slower arousal. Think of it like a garden hose that's been bent or pinched too many times. The water still flows, but not as strongly as before. The same can happen with your blood flow if you're not gentle or mindful of frequency. Now, let's talk about sensitivity. With repeated friction in the same way, using a tight grip, watching stimulating content, or always rushing to orgasm, the nerve endings in the penis can become less responsive. Some men call this the death grip effect. Over time, it can take longer to feel pleasure, or you may need more intense stimulation to feel anything at all. This can affect both masturbation and sex with a partner. For older adults, this loss of sensitivity may already be starting because of age-related nerve changes. Frequent, hard stimulation just speeds it up. The result? Less enjoyment, more frustration, and sometimes even performance anxiety. So, what can you do? The key is balance and mindfulness. Masturbation is not harmful in itself. In fact, it can be part of a healthy routine. But doing it too often, using too much pressure, or relying on intense visual material can begin to train your body in the wrong direction. Your penis starts expecting a certain kind of stimulation, and anything else just doesn't feel the same. Here's a helpful tip. Try doing your Kegels while brushing your teeth or watching TV. Build it into your daily routine. You'll be surprised how much control and confidence you can regain, even in your 60s, 70s, or beyond. In summary, your pelvic floor muscles are like the hidden engine behind much of your sexual performance. As you age, keeping them strong becomes even more important, especially if you masturbate regularly. By taking small, simple steps, you can support these muscles and continue to enjoy a healthy, confident, and active sex life. You deserve to feel good and in control, and I'm here to help you make that possible. As you grow older, one of the most important things affecting your sexual health and even your overall well-being is a hormone called testosterone. It's the main male hormone that plays a key role in your sex drive, energy levels, muscle strength, mood, and yes, even the health of your penis. In your younger years, testosterone levels are usually at their peak. But starting around age 30, those levels begin to slowly decline. And by the time you reach your 60s or 70s, you may have significantly less testosterone than you did in your 20s. This is completely natural, but it can bring along some noticeable changes. One of the first areas this affects is your sex drive, also known as libido. You may find that your desire for sexual activity, including masturbation, is lower than it used to be. Or you may still have the desire, but it takes more time to feel aroused or reach orgasm. This change doesn't mean anything is wrong with you emotionally. It's often your hormones simply adjusting with age. Testosterone also plays a key role in the quality of your erections. While erections are mostly about blood flow, testosterone helps stimulate the nerves and tissues that trigger arousal and maintain firmness. Lower levels of this hormone can make it more difficult to get or keep an erection, even if you're mentally in the mood. You may notice erections that aren't as hard or don't last as long, especially during masturbation. Now, here's something many older men don't realize. Excessive masturbation, especially if done very frequently, can lead to temporary drops in testosterone levels. After ejaculation, your body naturally goes into a brief recovery phase, during which testosterone may dip slightly before stabilizing again. If you're masturbating multiple times a day, or every single day without rest, your body may not have enough time to restore hormone balance, and this can leave you feeling more tired, irritable, or even emotionally down. This doesn't mean masturbation is bad. Not at all. In fact, when done in moderation, it can help relieve stress, promote better sleep, and even support prostate health. But just like everything else in life, balance is key. Your body needs time to recharge, especially when hormone levels are already lower due to age. If you're concerned about your testosterone, there are simple steps you can take. Regular exercise, especially strength training, eating a healthy diet rich in protein and healthy fats, getting enough sleep, and reducing stress all support natural testosterone production. If you're experiencing more serious symptoms, like extreme fatigue, depression, or very low sex drive, you might want to talk to your doctor about getting your hormone levels tested. In short, testosterone is like fuel for many parts of a man's health, and it's especially important in your senior years. Understanding how it works and how it connects to masturbation and penis health can help you make better choices that protect both your energy and your confidence. You're not alone and you're not powerless. With the right knowledge, you can age wisely and maintain a healthy, fulfilling sex life. Masturbation is a natural and healthy part of life, even in your 60s, 70s, and beyond. In fact, many health professionals agree that sexual expression, including solo activity, can help reduce stress, improve sleep, support heart health, and even boost your mood. But as you get older, your body changes, and so should the way you care for your sexual health. Let's talk about how to make masturbation safe, comfortable, and beneficial in your later years. First, understand that your skin and tissues become more sensitive as you age. The skin on the penis may get thinner or less elastic. That means aggressive or rough handling, especially frequent tight gripping, can lead to soreness, small tears, or even reduced sensitivity over time. Using a gentler touch and adding a good quality water-based lubricant can go a long way in preventing irritation and keeping your experience pleasurable. Next, be mindful of how often you masturbate. Everyone's needs are different, but for older adults, giving your body time to rest and recover is important. If you're doing it multiple times a day or every single day, and you notice fatigue, reduced erection strength, or soreness, that's your body telling you it may be too much. Try giving yourself rest days. Like exercise, your body needs time to rebuild and stay balanced. Position matters too. Many older adults tend to masturbate while sitting in a hunched position, on the edge of the bed or in a chair. Over time, this can strain your lower back and put pressure on your pelvic area. If you notice discomfort or tension, try changing your posture. Reclining back with proper support or lying down comfortably can reduce muscle strain and support better blood flow to your pelvic area. Also, consider the mental side of masturbation. While it can relieve stress, for some men it may become a habit tied to loneliness, boredom, or even anxiety. If you find yourself relying on it for emotional comfort rather than physical desire, take a step back. Think about other activities that bring you peace. A walk, a good book, or a conversation with a friend. Masturbation should feel like a healthy choice, not a hidden escape. If you use adult content, pornography, Be aware that it can sometimes lead to unrealistic expectations. Over time, this can desensitize your mind and body, making natural stimulation feel less satisfying. If you notice this happening, take a break from visual stimulation and allow your body to reconnect with more natural sensations. Lastly, pay attention to any changes in your erections or sensations. If something doesn't feel right, like sudden pain, swelling, numbness, or changes in ejaculation, don't ignore it. These could be signs of underlying health issues. It's always better to speak with your doctor early, especially if you're experiencing changes that affect your confidence or comfort. To sum it up, masturbation is not harmful, but how you do it matters more as you age. Gentle technique, good posture, proper rest, and emotional awareness all play a part in protecting your sexual health. Your body has served you well. Now it's your turn to treat it kindly, with care and respect. As we get older, it's natural to notice some changes in how our bodies function, including in our sexual health. Erections might not be as firm, arousal may take longer, and sensitivity might feel different than it used to. These changes are often normal with aging. But sometimes they can also signal that something more serious is going on. The key is knowing when it's time to talk to your doctor. If you're over 60 and masturbating regularly, you've probably already noticed some shifts in how your body responds. But if you find that you can no longer achieve an erection, or that it has become suddenly much weaker than before, even with stimulation, it may be time to speak with a healthcare professional. Occasional changes are normal, but persistent issues may point to underlying health conditions, especially those affecting blood flow. Erectile dysfunction, ED, can sometimes be the first early sign of heart disease, high blood pressure, or diabetes, even before other symptoms appear. Why? Because the blood vessels in the penis are small and can become narrowed or blocked before those in the heart. So if your erections are consistently weaker, don't feel embarrassed. Consider it a helpful signal from your body, not a failure. Another reason to seek help is if you're experiencing pain during or after masturbation. Or notice things like swelling, curvature, or changes in the shape of your penis. These could be signs of a condition called Peyronie's disease, which becomes more common with age and can affect both sexual function and comfort. You should also reach out to your doctor if you're experiencing emotional stress or anxiety around sex or masturbation. If you feel guilty, ashamed, or anxious, or if these feelings are affecting your sleep, mood, or relationships, that's worth discussing too. Your mental health is just as important as your physical health, and many older adults find that talking openly with a healthcare provider helps them feel more confident and at peace. If you're appreciated, following on the older started the Canada, remember to the logical job Nemiclus, don't wait for the problem to get worse. Many men suffer in silence, thinking, maybe this is just aging. But the truth is, help is available, and treatment options today are better than ever. Whether it's medication, lifestyle changes, therapy, or hormone support, there are solutions that can restore both function and confidence. Talking about sexual health with a doctor might feel uncomfortable at first, but remember, they're trained to help you, not judge you. You deserve to feel good about your body and enjoy a fulfilling, healthy life, no matter your age. In closing, here's what I want you to remember. Don't ignore warning signs. If something doesn't feel right, physically or emotionally, take action. You've earned the right to age with dignity, strength, and care. And reaching out for help, that's not weakness, that's wisdom. I'm here for you.